Several studies have confirmed many people all over the world have coronavirus, but unfortunately they don't show any symptoms. These symptoms are known as asymptomatic symptoms. The novel coronavirus is rapidly spreading globally and has put the whole world on standby, but researchers are still looking for vaccines. Nearly 80% of people infected by coronavirus will develop mild to moderate respiratory illness, which will usually recover without any treatment. However, one can easily recognize visible symptoms, but what about asymptomatic symptoms? These symptoms are shown by the silent carrier. These silent carriers are people who are infected with coronavirus but show little or no symptoms at all. As a result, these people carry the virus with them in their daily lives and can spread the disease without their own knowledge. It seems that most asymptomatic carriers are healthy young adults and children. And anyone who comes in contact with these people has a chance that they may get positive symptomatically or asymptomatically. 70% of infection could be attributed to spread from undocumented cases. Probably the undocumented patient were asymptomatic or had only extremely mild symptoms. One should know not having symptom of COVID-19 doesn't mean your body isn't infected. Some studies also estimated asymptomatic infection might be around 40 to 45% cases all over the world. And yes, there is no difference between virus shedding of symptomatic and asymptomatic cases. Obviously, the virus infecting the disease is the same, so the result they set also be the same. WHO also has confirmed that asymptomatic infections are a serious problem in this pandemic. Let's have a look at this clip from WHO.
Asked. One is the number of cases that are reported that are being reported as asymptomatic. And so we hear from a number of countries that X percentage of them are reported as not having symptoms, or that they are in their pre-symptomatic phase, which means it's a few days before they actually develop severe symptoms. In a number of countries, when we go back and we discuss with them, one, how are these asymptomatic cases being identified? Many of them are being identified through contact tracing. And so, which is what we would want to see, in that you have a known case, you find your contacts, they're already in quarantine, hopefully, and some of them are tested, and then you pick up people who may have asymptomatic or no symptoms or even mild symptoms. The other thing we're finding is that when we actually go back and say how many of them were truly asymptomatic, we find out that many have really mild disease, very mild disease. They're not quote-unquote COVID symptoms, meaning they may not have developed fever yet, they may not have had a significant cough, or they may not have shortness of breath, but some may have mild disease. Having said that, we do know that there can be people that are truly asymptomatic and PCR positive.
Even without knowing the specific numbers, the Center for Disease Control and Prevention believe that transmission from people without symptoms is a major contributor to the rapid spread of COVID-19 disease. In India, several studies show that asymptomatic cases are spreading on the daily basis. According to the study published in the IGMR, out of the total cases, 28% are asymptomatic patients. So at this point, no one knows exactly how many cases of COVID-19 are from the asymptomatic spread. But many researchers are convinced that it is playing a major role in this pandemic. Wearing a mask and practicing social distancing can prevent the asymptomatic spread. Anytime a virus can be spread by people without symptoms, you have to turn to preventive measures. That's all for this video. Thank you for watching.